Uh, the Canadian Index of Well-Being is built on 8 domains. We call them domains. Healthy populations, living standards, community vitality, democratic engagement, time use, arts, culture, and recreation, education, and the environment. And then we have a composite index that pulls all these parts together. What I can talk about today is the first 4 and the composite. So I will describe a bit on healthy populations and living standards, community vitality, and democratic engagement. And I'll give you an illustrative view of what the composite index will look like based on those 4. I'm not sure which side's best to stand on, but oh, this is much better. Okay, why a new measure of well-being? We want to promote a shared vision of what really constitutes sustainable well-being and the elements that contribute to or detract from it. We want to measure national progress toward or away from achieving that vision, and understand and promote awareness of why society is moving in one direction, in the direction it's moving. We want to stimulate discussion about the types of policies, programs, and activities that would move us closer and faster toward achieving well-being. And we want to give Canadians tools to promote well-being with policy shapers and decision makers as to account for why things are getting better or worse. And we want to add momentum to the global movement for a more holistic way of measuring societal progress. The keys to success that we've identified are leadership, collaboration, technical expertise, public engagement, solid evidence, and communication. And I'll say a little bit about all of those. Our vision is to enable all Canadians to share in the highest well-being status by identifying, developing, and publicizing statistical measures that offer clear, valid, and regular reporting on progress toward well-being outcomes Canadians seek as a nation. Regarding leadership, of indicator experts and practitioners reviewed what the CPRN people did. Then we had a national working conference on Pan-Canadian research, that group still exists. We call it the CRAG. That took us to 2004. Then we had cross-country consultations informing domain development. We had focus groups in 13 focus groups all across the country, from Newfoundland to British Columbia, to get some feedback on the basic framework and ideas that we had around developing this index. And then we had a second round of roundtables. And where are we now? And in 2009, last June, we launched the first 3 domains. So it's been a long, 10 years, 11 years slog, and we're not there yet, but we've covered a lot of ground. To begin our work around any of the 8 domains is we start with a commissioned analysis, sort of a lit review, environmental scan of what's out there, what's in the field related to, in this case, living standards. And that was done by Andrew Sharp and Jean-François Arsenault. And then we had a lit review environmental scan on healthy populations done by Nazim Muhajirain and Ron Labonte. And then we had a background study on community vitality that was written by Catherine Scott from the Canadian Council on Social Development. And the one we released in November, December last on democratic engagement was done by Lenore Swiston and Kelly Moore, Prairie Wide Consulting. Each of these background studies runs from about 100 pages to about 160 pages, something like that. So they are thorough reviews. Most of the stuff you could go on reviewing forever, but 100 and some pages of reviews is quite a review for each domain. Domain definitions, where'd they go? So we have rough domain definitions for each of the domains just to get some kind of conceptual bearing of what's supposed to happen in that domain. And living standards measures the quality and quantity of goods and services, both public and private, available to the population, and the distribution of these goods and services within the population. Healthy populations measure the physical and mental health of the population, those experiencing disease, disability, and delaying death, people's life circumstances, and the care that people receive. The domain of community vitality measures the strength and activity and inclusiveness of relationships among residents, the private sector, public sector, and civil society organizations that work to foster individual and collective well-being. And the domain of democratic engagement measures the participation of citizens in public life and in governance, the functioning of Canadian governments with respect to openness, transparency, effectiveness, fairness, equity, and accessibility, and the role Canadians and their institutions play as global citizens. So now in the next 4 slides, what I'm going to do is just give you, it's a very quick view, but each of the domains, we ask the authors of each of the domains to produce a set of indicators that we call headliners. And we ask them to produce anywhere from 8 to 16 headliners. And we pick 8 finally, a smaller group of us, depending on some criteria that I will show you. Seems to me the criteria should have been in there by now. But okay, we'll push on with these. So across the top, you can see what the 8 headliners are for the living standards domain. The ratio of top to bottom quintile, the after-tax median income of economic families, the incidence of economic families living in poverty, the scale value of economic security, the incidence of long-term unemployment, the employment rate, the CIBC index of employment quality, and the RBC housing affordability index. And what we have on the table are the raw data for the years 1994 to 2008. That was quick, but that's this. For the trends in the healthy population for indicators, we have self-related health, percent feeling excellent or very good health, the prevalence of diabetes, life expectancy at birth, the teen smoking rate, the percent with probably have depression, patient satisfaction with their overall health services, the influenza immunization rate, and the health-adjusted life expectancy for people 15 years and over. Now, the difference between this one and the slide before it is you'll notice that some of the numbers in this chart are in boldface and some of them are in regular type. Whereas in the previous chart, they were all in regular type. We have, once you get out of, in this country, and probably in most countries, once you get out of the domain of living standards and economic or financial information, you really have to pick and choose possible indicators to use. We just don't have anywhere near the capacity for measuring these kinds of things. And in the field of health, the figures that are in bold represent real data from surveys, from national population health surveys, which started in 1994. We create an index, I'll show you when we get through these 4 domains, an index based on 1994 as the baseline. And the reason we selected 1994 as the baseline is we wanted to capitalize on all the national population health surveys, which started in 1994. And those are conducted every other year. So you have 1994, bold numbers across the lot, 1995, are interpolations between what happened from 1994 to 1996. And you can see every other row is interpolated. It's not so bad. In fact, for these figures, if you did a full count of the whole thing, about 45% of all the numbers on the table are real and the rest are interpolated. And that's not so bad if you have them in a very systematic way, the way they are here every other year. A lot of the numbers that we deal with don't change that fast. So having the data, real data, every other year is not so bad. But now I'll show you one that is so bad. When we look for indicators of community vitality, the pickings got a lot slimmer. Across the top, we've got the percent reporting participation in various kinds of activities, the percent with 6 or more close relatives, the property crime rates and the violent crime rates, the percent who feel safe walking alone after dark, the percent disagreeing that they worry less about the needs of others, the percent who provide unpaid help to others on their own, and the percent reporting on unpaid volunteer work in the past 12 months. On this slide, you still have in the neighborhood of 40% real data, but you see the distribution is really odd. And that's because we rely on Statistics Canada data, and the surveys that they do are done at different periods of time and with a different periodicity. That's a word. And so if you look, for example, in the first row, you see we had nothing for 1994, 95, 96. The first survey we had with real data was 1997. So what we did was, rather than make up numbers, we used that 51% real data, and we filled in the blanks above it. When we have, and we always have at least 2 points of time, when we have 2 points of time, we do actual linear interpretations between the points of time. For example, between here and up close, it all looks the same, but between, that's bold, isn't it? And there. So when we have 2, we make linear interpolations, and when the sequence starts later, we project backwards. When the sequence stops early, as in this one, rather than do a straight line linear regression on the basis of the point, oh, sorry about that. 2, 3, yeah. Rather than do a straight line linear regression to get these later ones, we just project that one. So we try to project and interpolate and impute always on the conservative side rather than create numbers. So that's community vitality. And that's the fourth one, democratic engagement. And we've got voter turnout. Then we have the percent strongly agreeing that it's every citizen's duty to vote in federal elections. The percent reporting paying no attention at all to news about the federal elections. The percent reporting that they're very satisfied with the way democracy works in Canada. The percent reporting that they discuss federal elections often or several times a week. The percent who strongly or somewhat agree that the government does not care about what people think like them. The donation rate, this should be the percent of females in Parliament. That's the wrong name there. And the official international development aid. Okay, so that's the kind of data that we have. And you see in this slide we have a lot of regular type and relatively fewer. I think it's more in the ballpark of about 33% real data, and the rest had to be imputed. So then we built an index. And the index, as I said, was based on the year is 100. And what you have in those lines are percent changes away from the 100% baseline. And what you get in this picture, quite easy to see, is that small progress up to about 122%, about a 22% increase from 1994 to 2008, increase or improvement in the quality of life. And by looking at the different colored lines, you can see what's pulling us down and what's pulling us up. And this is just the GDP per capita line. This one here is the average index for living standards, and you can see the average index for living standards, which is what you would expect, is closest to GDP per capita, because it's largely financial data in our domain index, and it's entirely financial data in the GDP per capita. What's dragging it down? This is our health line. And what's next on the downside is the democratic engagement indicators, and the purple one on the upside is the community vitality indicators. The aim would be, working backwards, from the point of view of communication, it would be nice to be able to report on this number, the percent improvement, or if it deteriorated, the percent deterioration over a certain period of time. So you'd announce that number, and then people would say, well, what's that made out of? And then you'd look at these lines and see immediately, oh, well, we got a problem with health. So then you go back to the raw data in the health story, and you find out what's dragging us down there. We think of the index as the door to the system, with the index number itself, that is the CIW number itself, is the doorway to the whole house. We like to think of it as attractive enough that it will make people want to go into the house and see what the rooms look like, which ones are shabby and which ones are good, and so on. And the metaphor works pretty well. You can also see that if you just had the GDP and didn't have these other trends at all, you wouldn't have much of a tool for policy making. You wouldn't have much of a tool, that GDP per capita, would not be much of a tool for telling you whether all things considered, that is, all things that most people think are important to them, have gotten better or worse over that 15-year period. GDP doesn't do the job. The CIW leads you to a more complicated picture, but it begins to do the right job, at least, begins to tell the right story. Okay, some highlights. I guess I have about 5 minutes. 5. Just some highlights from the domain reports, actually. Canadians are experiencing a widening of income and wealth inequalities. The fight against poverty has stalled since 1981. Some poverty reductions were not nearly as large as the increase in wealth inequality. Between 1981 and 2008, the incidence of long-term unemployment is higher now than it was in 1981. Since 1981, many dimensions of living standards in Canada have not improved, despite a 53% surge in GDP per capita. Well, before the recession. Yeah. Well, there's that. And we get this kind of stuff out of healthy populations. Life expectancy rates are among the best in the world. A closer look at health indicators reveals a more mixed picture. Canadians are living longer, but not better. You remember the last column, or maybe you remember, the last column of the healthy population was the health-adjusted life expectancy, and that's the thing that's gone down while life expectancy has gone up. Canadians are increasingly likely to develop a chronic disease or mental illness during their lifetime. For more than a decade, merely 65% of Canadians have declared their overall health very good or excellent. Self-rated health is considerably lower than it was 10 years ago. I'll leave the rest of that. community vitality, you get stuff like Canadians have a strong social relationships with their families and communities. There's a positive trend of most of the indicators suggesting that the well-being of Canadians, as measured by the quality of their relationships, is improving over time. We're well equipped to deal with current and future challenges. And on democratic engagement, fewer Canadians are voting, as you know probably. Turnout in the most recent federal election, 2008, was the lowest in Canadian history at 59%, down more than 10 percentage points from 1993. Participation rates in formal political activities are extremely low. The number of people volunteering for law advocacy and political groups has hovered about 2% or less throughout the past decade, and the hours volunteered dropped by 15% from 2004 to 2007. What have we learned? There is a challenge of tracking change over time when data collection is not consistent over time, and data's time series are changed, the wording of the questions has changed or dropped altogether. There's a need for increased data collection at the sub-municipal level, community and neighborhood level. There are a lot of people across this country working in neighborhoods and working in municipalities where they don't have the capacity to collect their own data, and they really could use something like a national template with data collected by Statistics Canada, so they could just draw on it and get a story about their own community. There are an enormous number of people who are trying to get that kind of output out of Stats Canada. The need for integrated government community frameworks for collecting, organizing, and disseminating data. The benefits of intersectoral policy-making models that will lead to better measures of well-being and reduce silo decision-making and cross-purpose planning. Excellent community-based intersectoral models across Canada. And the need for a national index as a foundation for linking regional, provincial, and community-based indicator initiatives. Recommendations. Successful policy development is best done through government and civil society partnerships with a focus on systems change. Successful policy development is best done through intersectoral collaboration with all aspects of well-being. Data collection by government agencies is best advanced by strategic partnerships with those who use data and can inform its use over time, development over time. That's probably the end of my time, isn't it? For more information, contact Lynn. She's sitting here. But the slide will be on the website. Thank you. That's it.